Hey, good afternoon, Scurry County. It's Dan, County Judge. I'm here with Christy Hanley. She's Chief Quality Officer at Cogdell. Thank you for coming in today. You've got a lot of good information. We were talking right before we started all of this. Before we get into that, let me kind of give some of the numbers for the Scurry County. Scurry County currently has 63 active cases. We have 20 that have recovered. We have one death and a total of 84 cases. I got a call from TDCJ today, and we have 169 inmates who have contracted COVID. They've also said that there are 11 employees that have it, but we don't have all of that data extrapolated yet as to how many are actually Scurry County residents. So they're working on that, getting that information. And it's probably going to be, they have to send all their information to DSHS, and then DSHS sends it to our local health department, and that can take up to a week. So that's why we wanted to go ahead and get that out today, right now. So, but thank you, Christy, for coming in and agreeing to sit and talk about what's going on. So,
Sure.
Where would you like to start? Because there's a lot.
There is, I mean, I think when last we spoke, it was maybe March, and we were in the midst of mayhem, trying
Yes,
to get
ma'am.
testing,
Yes, ma'am.
and we've succeeded there. We've got testing, and now we have positive results.
Now we have positive results.
Um,
Absolutely.
Though that's not necessarily the reason. I know that there have been some people who have speculated that increased testing has led to increased positives, which not necessarily so. As a matter of fact, there are independent indicators such as the rate of hospitalization that has absolutely nothing to do with the amount of testing
Okay.
that's happened. And just over the last 24 hours, Texas broke all records to date for new cases in a 24-hour period, new fatalities in a 24-hour period, and new hospitalizations. There were, as of this morning, well, actually, I guess it would have been yesterday morning, 10,028 new cases in a day, 60 fatalities, and 9,286 people were hospitalized.
Wow.
Yeah,
That's
that
a
gets
lot.
my attention.
Yeah, absolutely.
Especially
Absolutely.
yesterday, the previous 24-hour period, we had a little over 5,000 new cases.
Right. Yeah.
Not quite doubled, but just about.
Just about.
Very concerning.
It is concerning. And around here, what I've heard is that right around the Father's Day weekend is when it really kicked up around here for us. Is that what you're seeing, or what are you seeing as results? Is it from opening Texas up? Is it from?
Well, we did there. Our first spike seemed to be a couple of weeks after. So it was mid-May. So after,
Okay.
we had Mother's Day and opening Texas up kind of,
All at the same time.
yeah, and graduation. So
Graduation.
it would have been difficult to kind of tease out which one of these things might have contributed. But we know now that it's everywhere. I mean, there really isn't a place that has not been affected. I think early on it was easier to think, well, that's somewhere that, that's the coast or the north, and that's not. Texas is somewhat protected. We have more space.
Right.
Not so much.
Not so much, because if we go around somebody who has contracted, go to another location, we bring it back here, and that seems to be kind of what's been happening. I think is that a lot of people have gone, well, we're open up now, so let's start moving around, and then we all bring it back here. So.
Yeah, and I think because the initial cases that were identified here were so late in the process, I think maybe there was a false sense of invulnerability.
Sure.
And perhaps people were not as careful as they might have been if they had thought that the threat was immediate.
Sure.
But it's here, and the threat is immediate, and it is it's everywhere. I am concerned about people who have, contracted the virus being stigmatized, and there's no need for that. I feel like it will probably come to, a good number of people before we have vaccination available.
I agree with that. Yes, absolutely.
I don't see, from what I'm reading, I don't anticipate having any ability to have widespread vaccination anytime in 2020.
That's what I've been seeing too. The first indications were 18 months. Possibly 2 years for any type of vaccine is what I was hearing. So.
On one hand, we want it yesterday. That would be
Absolutely.
great. On the other hand, I do want them to be careful and,
Absolutely.
to use all due caution
Yes,
and so that one, it is actually effective
Mhm.
and that it isn't dangerous.
Absolutely. Yes, ma'am. And we were talking about some of the um, milder cases having some longer term um, problems. Can you kind of go into
Yeah.
some of those?
Well, it's real. I was checking out the Scurry County COVID Facebook page a little while before I came up here. There were some really good questions, and I think one person had observed and commented on the fact that why do we still only have 20 recovered?
Right.
Well, that one's multifactorial. One, 14 days ago would have been June 25th,
Mhm.
and we had 49 of the new cases identified since then.
Right.
So there are many that would just not even. But more and more studies have identified the fact that it isn't exactly a 1 or 2 week kind of illness and you're done, even for milder, mild cases and some that initially appear to be asymptomatic later on, develop mild symptoms.
Okay.
Um, they're actually calling those long haulers.
Okay.
And there have been, instances where they're lasting months.
Mhm.
A lot of the data is just, I mean, things were absolutely crazy in March, April, even into May.
Sure.
Just within the past 2 to 3 weeks, a large amount of data has become available from autopsies and
Okay.
from um, large surveys of citizens and patients, people who have been identified as having the virus, and a
Mhm.
lot of that information is it's really interesting. It's showing that the virus may have long-term effects that we weren't necessarily anticipating.
Right.
They have looked to some previous viral infections like SARS,
Right.
which was much more severe but somewhat similar, and
Mhm.
also in terms of the long-term effects, Epstein-Barr, which is very common, almost everybody's had that, but a
Okay.
lot of people that get that go on to have chronic fatigue syndrome.
Okay.
They're identifying some chronic fatigue syndrome.
Wow.
There were multiple studies, but one of the more impressive ones was a Dutch report, and they had surveyed a pretty large number of people, and they found that there was intense fatigue in 88% of them, continuing on several months after the infection was identified.
Mhm.
75% of them had persistent shortness of breath.
Wow.
45% had chest pressure, and 91% of these
Mhm.
were never hospitalized. They were mild cases.
Wow.
So I have heard in the community, well, let's just get infected and get it over with.
Right. Yes.
If you're lucky, maybe, but if you're not one of the lucky ones, it could be a really protracted ordeal.
Sure. Even for mild cases, it could
Yes,
be.
and again, I know that SARS
Mhm.
was a much more serious disease and
Sure.
much less widespread. However, there were a little over 20% of the people never were able to return to full-time work.
Oh, really?
Yeah.
Okay.
So, when you think about where we are in terms of the economic situation right now,
Yes, ma'am.
if we have long-term debility related to mild cases of this,
Right.
it could be overwhelming.
It could be. Absolutely. Yeah.
So I'm very concerned.
Sure. Okay. Well, that makes absolutely sense to be concerned about that. And that's information that the general population doesn't have that I think we should have. And so that's why I'm glad you're here is because there's a lot of people that don't realize just how severe it could be, even in mild cases, and how far it could last. I didn't realize that until we were talking just a short time ago before we started this. And so it's
The experts are just now starting, over the past month, a lot
Mhm.
of this information has surfaced about,
Right.
again, the fatigue, the weakness, that there's been lung scarring. So, problems breathing long term,
Right. Even in mild cases.
even in mild cases.
Yeah.
And one of the ones that's scariest to me, that's the least understood right now, but
Mhm.
I know that they're applying more efforts here, is the neurocognitive. So there've been, I know I sound like one now, short-term memory loss, depression, a lot of the just altered, people feel altered, and
Sure.
they're not able to quite regain that level of functioning that they
Mhm.
had in terms of executive function, making decisions, coordinating schedules, time,
Right.
things like that. Those abilities have been hampered in many of the cases, and that's something that is concerning as well.
That is concerning. So, did you see any other questions on there
I
that you
did.
thought?
I did. And there, a lot of people had, or, well, I don't know, there was a lot, but I saw several questions
Sure.
about the overall testing numbers.
Mhm.
I will say this about that. I have some information. It was current as of about 8 o'clock. It is probably 30 minutes after it was extracted. It's
Okay.
no longer current
Sure.
because we are testing at a pretty high rate, which is great.
Absolutely.
As of about 8-ish this morning, we had tested 1,572. Well, we had not that many people, but we had done that many
That many
tests.
tests. Okay.
Um,
Some are
not
going to be repeat tests.
some are going to be repeat tests,
Mhm.
and not all of them are from Scurry County.
Sure.
Most of them are.
Okay. And
Um,
this is just Cogdell that's done this testing, correct? Or are you talking
well,
from the
these are
reports
from
that we get?
the patients that we obtained the specimen here.
Okay.
So, I mean, yes, may have been tested at a reference lab, or it may have been tested here.
Okay.
So it's all of those. And again, north of 1,500 of those. That's pretty significant testing for a town our size.
It is. Yeah, that's at least 10%.
And of those, we had 113 positives. Again, some
Mhm.
repeat tests, some non-Scurry County residents. So
Right.
that's about a 7% positive rate,
It is.
which is in line with, Lubbock, I believe, had like an 8% rate today.
Yes,
Some
ma'am.
some other areas are pretty similar.
Mhm.
I know people would probably like, more detailed information, and
Sure.
that would be great if we had, a huge staff of people just doing data analysis.
Absolutely. Yeah. And that's one of our issues is that right now we have 63 current positive cases, and we just don't have the staff to really get more information than that because they're doing the tracing. They're finding that for each person, there's at least 10 contacts that they have to make. So 6,300, 630 contacts that
That's a
they have
lot.
to do. And we're looking at a staff of 5 or 6 people that are having to do that. So that's one thing I'd like the public to know is that we just don't have the staff to really get out a whole lot more information because um, they're just working to the bone trying to get contact tracing right now and get those people tested. And then once they get those people tested, the contact tracing just continues.
Yes, and for the ones that are positive, there's ongoing monitoring of those patients to,
Absolutely.
so it is a substantial task, and I am so appreciative of our health unit and all of their efforts there. That's a lot, and that my role does not have anything to do
Right.
with that. I do, I do analysis of some of the pieces of data for other things that we need them for. But
Mhm.
yeah, uh, I I certainly understand the interest. I'm interested in detailed information. That's kind of,
Right.
I'm a data nerd, um, but what we have is kind of that raw data right now.
Right. Yeah, absolutely. The other question I've heard is hospitalizations.
Yes.
How many do we have? And that one of the answers that I saw this morning was that that can get really close into privacy issues.
Yeah, that's always one of the problems here in terms of, whenever we get even general questions,
Mhm.
everybody knows who's,
Sure.
it doesn't take a whole lot of information released, and people would be easily able to identify. But and that's not really, it's not even something that's going to be pertinent. It's not going to help people stay safe.
Sure.
And honestly, um, we try whenever we have COVID positive cases that require hospitalization. Our our process right now is to transfer to a COVID unit where
Yes, ma'am.
where they're prepared to deal with that, and that's pretty much what they do all day.
Right.
We While we are not in anywhere near the condition of the metro areas with regard to our headroom for
Mhm.
ICU and beds and all of that, we are, it is starting to fill up in this region. It is starting to become more difficult for our physicians to transfer patients out.
Sure.
So that's not unanticipated. Uh, it's it's unfortunate, but not unanticipated.
Right.
Yet another great reason for everybody to take every precaution necessary and to really abide by the guidelines that have been put out by the governor, by DSHS, CDC. I think everybody's speaking with one voice with regard to that now,
Yes,
and
ma'am.
that's helpful.
Yeah.
But it's critical. Now, if if it comes down to it, and I did notice that somebody had wondered on Facebook whether we have ventilators. We do. We
Mhm.
do have that capacity.
Right.
But again, it's, when we start having people having to be quarantined,
Mhm.
that includes healthcare staff.
Sure.
And so, it doesn't take a whole lot before our staffing levels would be compromised. So we're trying to keep everybody healthy.
Absolutely. And that's the one constant is that um, whatever your belief is, if you believe that um, I'm only gonna get mild symptoms, or it's not gonna affect me, or I'm gonna end up in the hospital, whatever you are, wherever you are on the spectrum, um, one common is you will be quarantined for 14 days minimum. Um, and that's something that I've really hadn't pushed on a whole lot, was the quarantine aspect of it. Where we are with quarantine. So if I get it, my wife will probably be quarantined. My family will be quarantined. My office staff will be quarantined. Um, which, if we've gone and made contact with other offices, they're probably going to be quarantined if they've had direct contact with me. So it's easy to get to where it's spread far and wide, just on a quarantine basis.
Yes, I mean there have been entire departments of what would be considered like city infrastructure shut down
Yes,
because of quarantine.
yeah, yeah. I think Abilene Health Unit at one time was hit pretty hard,
Yes.
and they all had to quarantine. So you effectively can shut down in the entire aspect of the hospital if you have a big outbreak there, or the county government too. So, um, and that kind of leads into one of the questions that we had is, what exactly does quarantine mean? Does it mean that I can go take someone to the grocery store and they can get out and go in? Can I go to Sonic and drive through? To me, that's not quarantine.
Well, if that person in your car is not a member of your household already, then you are already not in quarantine.
Right.
That typically you will see households quarantined,
Right.
and I know that it's kind of been confusing in that you sometimes you hear the term isolation, sometimes you hear quarantine.
Sure.
Historically it's been, if you are sick, if you
Mhm.
have symptoms, people are said to be isolating, and if you
Right.
have quarantine, you've just had contact but you haven't demonstrated symptoms.
Mhm.
They typically use the word quarantine. Either way, whichever way you hear it, that means you don't need to be running around. You need to stay in your home. Um, if you have friends, fellow churchgoers, things like that, a lot of times
Mhm.
they're able to go to the grocery store and leave them outside the house. There are
Right.
various ways of accomplishing the things that need to be done without breaking quarantine. And
Mhm.
I know, I mean, it's a hassle. I mean,
Sure.
it's an absolute hassle when I think that's one of the things that I think everybody's exhausted from having to think about everything, every
Absolutely.
daily decision.
Yes, ma'am.
Mom, can I go here? Well,
Yeah.
no.
Yeah. Have they been around? You've got to ask if your his friends have been around somebody that, and are they going to be able to give you the correct answer? So
Exactly.
um, how far do we take it, and how long do we do this? And I don't know. Everybody's COVID tired. It's just a matter of when and where does it stop? Is
That is,
the
and you know what? I mean, I was struggling with that this week.
Mhm.
Thinking, I want my kids to still have a life.
Mhm.
I, but at the same time, I can't, in good faith, do anything that might compromise their long-term wellness.
Sure.
And I don't think we know enough yet about what the final outcome is going to look like for
Right.
even mild cases, and I think that's something to be considered. Not only that, but maybe the kids and I do fine and we never get it.
Sure.
But if we become a carrier or we come in contact and, spread that, the person that is the recipient might not be so lucky. And that actually really bothers me a lot to think
That
about that.
that's my chief concern. If I get it, and I've said this multiple times, I'm not so concerned with if I get it, but if I were to get it and give it to somebody who might be immunocompromised or might have an underlying condition that would exacerbate the problem. So I wouldn't want to do that to somebody. So that's why I wear my mask.
And now we don't, I mean, so yeah, we know a lot of the people in our circles that may have underlying diseases or things that might kind of put them in a high risk category. But there are so many things that you just can't account for, and
Sure.
that case may not be one of the ones that just resolves spontaneously in 14 days, and there's no way to know.
Right.
That's what's so frustrating. So, I mean, really focusing on, and there's so many things that we can't control. So I think it's really important to focus on what we can do that's
Mhm.
positive, and that is
Absolutely.
consistently wearing masks in public. Nobody likes to wear masks. They are
No.
not comfortable. They are hot, not fun. That said, now that we have this sort of universal masking, you know, my mask protects you, your mask protects me. So
Right.
it isn't as important, in the hospital, we really need a good seal, a good tight seal,
Hmm.
because we are, it's not just about source control. We're trying to protect our healthcare providers so that we
Absolutely.
can keep them at the bedside.
Yes, ma'am.
But out in the public, they don't have to be the super tight, hot N95 masks, a face
Okay.
covering. So
Right.
if I've got source control and you've got source control,
Mhm.
that does make it a little easier.
Okay.
And I think that's something important to remember. You want
Mhm.
it covered. You want to, you don't want droplets going forward.
Right.
But it doesn't necessarily have to be the hottest, tightest mask you can possibly get on. If everybody's wearing it, that kind of takes the load off of all of us.
Sure. Absolutely.
So that helps. And I think the consistency with wearing those is important. Hand washing, always,
Always.
always.
Yes, ma'am.
And staying home as much as possible. I know
Mhm.
people are weary and getting cabin fever if it's not already gone well beyond that, but it is where we are right now.
Yes,
And
ma'am.
the alternative of having to either be shut back down and have, further economic woes waiting for us whenever this thing is over,
Right.
or, more illness, more widespread illness, whether
Mhm.
it's severe issues or whether it's just long-term debility. Those are lasting issues, and
Sure.
we tend to focus on things that are immediate. That's just how we're hardwired.
You're absolutely right. We don't have the patience to deal with a lot of it, and I'm just as bad as anybody else as far as that goes. And you hit on a key aspect there, economic, in that we don't want to shut down.
No, we do
We
not.
went through that. It's something that I don't want to have. I don't. I'm not going to do it. I'm not going to put another shutdown in place that like we had before. But I don't want to see anybody that's in a higher ranking position than us, like the governor, feel like he needs to do that. And I think the more the cases grow, um, and they're looking at the areas that are the highest growth. They didn't just say bars because they wanted to pick on bars. They said bars because that's where their
The
tracing
contact
was
tracing led them
finding.
right there.
It did. So um, I that is a chief concern of mine. As well as the sickness side of it is the economic
Yeah, I
side of
mean,
it.
it's kind of a domino effect. So,
Mhm.
if the economy shut down, people lose their jobs, they lose their healthcare insurance, they're not
Absolutely.
able to stay well, they
Mhm.
become more susceptible, we get more widespread disease, and it becomes this sort of perpetuating,
Sure.
um, and it doesn't have to be that way. Now,
Right.
it's going to require a lot of sacrifice and
Mhm.
self discipline, and you know what? It stinks. It
It
just
does.
does.
It does. And I do not like the fact that I am told, and there's a lot of people out there. I've had lots of people say, I don't like the fact that I'm told that I have to wear a mask. I disagree with with the fact that we were told we have to do it, but I'm going to wear one. I'm going to wear one to protect those that I come in contact with. And that's just where I stand on it.
I'm
Others are
told to
going to
drive
disagree.
70 on the highway.
You're told to wear your seatbelt as well.
Yeah.
know? So there are lots of things that are designed to keep us safe. Well, I don't agree with all of them, but when I was a police officer, I didn't always agree with the law, but I enforced the law. So I don't necessarily agree with the requirement to wear a mask, but I agree that we should wear masks to protect each other. So I'm going to wear a mask.
I think we as humans, we benefit from being in a community. And being in a community sometimes means that, yeah, I don't necessarily agree with everything.
Right.
But, we kind of come to a consensus and that's what we do because it's good, the greater good.
Yes, ma'am.
And-
we have
and-
to make sacrifices on occasion.
Yeah. And this is a great community. We've got lots of really good people and I really want to see them stay well.
Oh, I do
And
too.
to that end, don't put off the things that, if you do have underlying illnesses, chronic illnesses, call your doctor, go be seen. There's no reason, we can get all kinds of creative in the delivery of healthcare. So don't let this be a barrier. It's very, very important to stay well, to do everything you can to stay well.
That's a very good point because I think that fear is there for some that they might catch it if they go out to the doctor's office, or they don't want to go to the doctor's office for various reasons, and that is one of the reasons is that they're afraid that they might catch it if they go out there. There's, like we said, there's the whole spectrum on beliefs on where we stand.
I would think, and honestly, it's a very minimal risk. I mean, there's minimal risk everywhere, but everybody at the hospital is masked, has been masked for
Right.
a good while. Our doctors are really, really careful. Our nurses are very, very careful. And again, you want to be in as good a health as possible in general, but certainly during this time, anything that makes you more vulnerable, it's not a good place to be right
Sure.
now. So, go ahead and take care of those issues. And if you do have concerns about that, call. Everybody's got different concerns and we can tailor healthcare delivery accordingly.
Absolutely. Telemed is huge right now. So I know they've been using that quite a bit.
And if, I know we've had lots of job losses and things like that. We have a department, the MASH department. If financing for healthcare is an issue, not having insurance, call the MASH unit and work with them. But please take care of your health. I mean, that's really important.
Okay, very good. Well, is there anything else that you'd like to bring up? I think we covered quite a bit.
I think we have. I mean, if there, I do put, I put out information for the hospital on an almost daily basis. I have a lot of the things that I read are more on the kind of scientific journal side and might not necessarily be of interest, but I'm certainly willing to make any information available if anybody has an interest in that. If there are specific questions,
Sure.
I certainly don't know all the answers, but I've got a good idea about where to find a lot of things.
Sure.
So, just let us know. There's a way to put questions in via email on the hospital's website.
Right.
There's also the Facebook page, or call and ask.
Sure.
If somebody, if the person you get on the phone doesn't know, they'll pass it on to someone who does. So,
Absolutely.
there's no need to wonder. We'll let you know anything that we know. No, there's a lot that is unknown,
Yeah.
but what we do know, we're happy to share.
Okay, that's very good. Very good. There was something I was going to look at. No, we covered that. So thank you everybody for watching. I appreciate all the information, Chrissy. I think that is fantastic information that we put out there today, or that you put out there, because this is something that you've compiled, and I appreciate you doing all the hard work on getting this information for us. So with that, y'all stay safe. We'll talk to y'all soon. I'll probably see y'all tomorrow. Y'all have a good day.